Suzanne. So, our final speaker tonight first launched her public presence, in the independence campaign at a Women for Independence meeting here in Clydesdale, just in May of this year. And since then, her YouTube video has gone viral. She's spoken at a huge number of events all across Scotland. She's been on television, she's been in various newspapers, she's even been the topic of conversation at First Minister's Questions at Holyrood. The outcome of that has not all necessarily been very pleasant for her, but she's sticking with it. And she's now accredited as the person who's really brought the whole issue of the future of the Scottish NHS to the fore in this debate that we're having now. So I'd like you to welcome Consultant Breast Surgeon Dr. Philippa Whitford.
Wherever you want. Well, thank you very much for that. It wasn't actually me that launched it, it was these twa bills that launched it. All he said was, do you mind if we put it on YouTube? Oh, that'd be fine, I could show my mum. And then they put it up a week later and someone goes, you've gone viral, you've got 1,000 hits. By the time I got on it, we were at 9,000. And the rest is history. Due to what's been happening in the last week or so, I would like to point out that the bulges under my top is not flab. I'm actually stick thin, as I'm sure they will attest. This is Kevlar. Okay? This is women's Kevlar, and it's chafing something rotten. Anyway, if they thought that they were going to shut me up, obviously they didn't know me very well. My husband can attest that's quite difficult. And I didn't spend a year and a half working in Gaza City to be shut up by an article in the newspaper giving me a bit of a doing. We've only got 3 weeks to go, and then we're going to make this absolutely momentous decision. And simply being part of this, my husband and I have travelled 3,500 miles since the three of us were together in Straven at a Women Friendly meeting. And we've been in town halls and village halls on wet, rainy nights like tonight and sunny Saturday afternoons, and just really incredible. The turnout of people, the energy of people, and the interest of people. And unfortunately, the media is missing out in this story because it's a bit too positive for Yes. So hardly anyone is actually telling the simple story of how alive, awake, engaged, and energised Scotland has been for the last 6 months. And having seen it from Langham to Elgin and Arran to Fife, it is absolutely amazing. Now, what I want to talk about is obviously what we're going to vote on in 3 weeks' time. And that is only one thing. It's, do we take control? We have control, as Jim Sillars says, from 7 in the morning till 10 at night. We are the sovereign people. We are absolutely and utterly in charge of our futures. And at 10 o'clock at night, have we handed that back, or have we decided that we are going to keep it? Now, obviously, I believe very strongly that we need to take control so that we don't have decisions foisted on us that I don't think we would have made. I don't think we would have invaded Iraq. 2 years from now, we're in danger of being dragged out of Europe, whether we want it or not. And that's what happens to us. Votes happen in Westminster, and our little vote has no real impact on it. And the people we send as MPs have no real impact on it. The vast majority of our MPs of all parties voted against the bedroom tax. Much good it did us. And that is the story of Scotland of all of my adult life. Now, what we've seen also over the last 35 years, while I've been an adult, is the relentless move of public resources into private hands. It started with Mrs. Thatcher, it went on through the Labour Party, and this lot are just kind of in orbit doing it. And now it's the turn of the NHS in England. Now, I didn't start following this story because of the referendum. I didn't start following this story because I was going to make a speech. I started following this story in 2011 because I couldn't believe what they were talking about doing. And I started looking at their media. Now, I'm lucky I get a media link sent to me every working day by my college in Glasgow that will flag up health stories from all over the UK. Now, I signed up to them because I'm a breast cancer surgeon, and breast cancer patients are very educated. They go into the internet, they look things up, and they turn up in the clinic with a sheaf of paper asking me questions about something I've never heard of. So I just have to keep one step ahead of whatever cockamamie story, miracle cure, super invention is suddenly in the paper today. And I started to see, because I do see the English Telegraph and the English Guardian and the Independent, what they were talking about. And I started just printing out articles and listening to what was being said. And what really picked up in the spring of this year was they were obviously coming to the end of their first year. The actual changes started in 2013. And as we approached April 2014, people were looking at, well, how has it gone? What's the money looking like? What's the service looking like? And I was really shocked. What has happened in the NHS in England is that it has been broken up and set up not with health boards like we have, but commissioning groups of GPs who just buy services for the patients they commission for. The Secretary of State in England is no longer legally responsible to ensure that every citizen has health care. And that is a huge change. Now, every single service that they commission must be put out to tender to private companies as well as the NHS. And whoever bids cheapest wins. Now, in that first year, 70% of all those new service contracts went to private firms like Virgin and Atos. What they tend to do is they tend to pick off the kind of easy, lucrative cases. If you're fit and healthy and you need a new knee, particularly a lot of surgical stuff, because you come in, you get your new knee, you go home, kerching, they have the money. But if you're diabetic, they don't want to know you. If you've had a stroke, they're not really looking after that. If you have a complex cancer, they're not going to do that. If you have a terrible accident and you're in hospital and in intensive care for weeks, they don't provide that. So they're picking off all the kind of edges of the NHS, doing quite a lot of GP practice work, community hospitals, things like that. And that leaves the NHS, as is left, obviously with sicker and sicker and sicker patients. And at the end of just 1 year, 40% of all trusts in England were in debt. Over 500 million had to be put in by the government to bail them out. Now, the year before the changes, the NHS actually balanced its budget. It's really hard and it involved moving money around, but they actually balanced their budget. And now they overshot by millions. So suddenly everyone is saying, oh, this is awful. Something must be done. We can't go on like this. The NHS has to change. And what's being talked about now, and we still aren't hearing up here, is that they're talking about charges. Now, there's no politicians talking about charges yet. It's at the level of the media and the think tanks. Reform UK have suggested that you pay £10 a month into a kind of NHS club, if you like. Now, that sounds horribly like a very, very cheap version of health insurance. How long would it stay at £10 a month? King's Fund are suggesting that you should probably pay whenever you go to the GP, either £10 or £25 each time you go. And to make sure that people wouldn't just all rush off to accident and emergency instead, you would have to have at least the same charges or dearer to go to accident and emergency. Now, some of you who are quite comfortably off may be sitting here thinking, well, that would be okay. I could pay that. I would pay that to save the NHS. And on a recent phone-in, I heard people saying that. I would pay £25 to save the NHS. Well, I'm sorry. If you're paying £10 or £25 to go to your doctor, you haven't saved the NHS. The NHS is finished. The 66-year experiment of free care when you need it would be over. I should have had an Uncle Pat who was an elder brother of my mum, and he died when he was a child, back in the 30s. He'd an abscess on his neck from which he got blood poisoning because they couldn't afford the small fee to go to the doctor. Now, we all don't remember that, but that's what they had. That's why the NHS was set up. And Aneurin Bevan resigned in 1951 when they introduced prescription charges, because he said that is charging for healthcare. And that's what they still have down south. We've already started to get so used to free prescription charges, we can't imagine they would ever come under threat. But people in England pay over £8 an item. And what was noticeable when we got rid of them is GPs recognised that patients were actually picking up their medication and taking their medication. There's been studies done down south of chronic illnesses in people who are not exempt from paying. And they did a survey of nearly 4,000 people and found that almost 3/4 of them had missed out at least one medication off every prescription because of cost. And 10% of those who had missed their prescription and had felt more ill because they'd lacked it had ended up in hospital. What money did that save? That is the whole point of free prescriptions. Now, what they say, the reason for radically changing the NHS in England, and remember, this wasn't in the manifesto of either the Tories or the Liberal. Well, the Liberal, it wouldn't matter what was in their manifesto when you see what they did to free education, which they had promised to fight for, and instead they trebled the fees. But the Conservatives clearly had stated no top-down reform, and in actual fact they've just blown the whole thing up. The excuse they give is it was to decrease cost and increase efficiency. Now, if you want to look at that in a little more detail, there's a thing you can look up on the internet called the Commonwealth Fund. Now, it's nothing to do with the Games. It's actually a think tank in Washington. And they compare the US system with other systems around the world every few years. And they just happen to have published the report a few months ago. It's called Mirror Mirror. But if you put in Commonwealth Fund, you'll find the report that's for 2014. It's based on the data from 2011 to 2013, so before the current changes. And it compares America, Canada, France, Germany, Australia, New Zealand, the UK, and others. So, we're so expensive and we're so inefficient, yet we came out number one. We came top overall in that report. And we came number one in 8 out of the 11 parameters they measured, including things like quality, efficiency, safety, patient access, patient-centred care. We came third in waiting times, which everyone makes out, oh, the NHS, it's terrible, you wait for ages. Waiting times have changed dramatically. Older people in here will remember when you waited years to get something done on the NHS if it wasn't urgent. Again, we just take these things for granted. But we came third best in the world, in a free system. We came 10th in life expectancy, what Isabel was talking about, the gap of more than 25 years between the middle of Glasgow and the middle of London. That's a disgrace. So, we must have been really, really expensive then. We can't afford it. We can't go on. No, we were second cheapest. The only system cheaper than the UK system of gathering the tax in and just delivering the tax out, the healthcare out to everyone, was New Zealand, where you do actually pay a fee if you go to the doctor. So if we're actually best for quality and second cheapest, what on earth are they doing? What do they think these reforms are meant to achieve? And to me, it is one simple thing. It's a matter of ideology. Westminster believe that markets rule. We've had 30 years of nothing should be delivered by the state, nothing should be public, everything should be delivered private, and quality will come through the open market, through competition. Now, we all pay our energy bills, and we know that we feel that nip in the air which means that shortly we're going to get informed that our prices are going to go up by about 8 or 9%. And one of them goes up just after the other. So we didn't exactly get a great service out of privatising the energy companies. And we're not going to get a great service out of this either. And if you think back to Mrs. Thatcher, she set up an internal market. If you remember, all our hospitals had trust in the name, and we all pretended to compete with each other. And when I started in Ayrshire, we had Kilmarnock and we had Ayr. And we didn't speak, we didn't meet up, we didn't share ideas, we didn't do anything, because we were in competition with each other, with GPs pretending to buy services. But what we did in 1999, when we got devolution, was we turned on our heel in 180 degrees, and we went right back to being a unified, public, Scottish NHS. And because of that, we've actually been able to work together right across Scotland to do some really big projects on quality and safety. In 2008, they set up the National Patient Safety Initiative, which is recognised in other parts of the world as literally an example of how to reduce mistakes, how to make hospitals safer, how to make surgery safer. And Scotland's able to do that because we all work together, we publish our problems, we discuss our problems. We also have the Quality Improvement Scotland, or now I think it's Health Improvement Scotland. It's a bit like Better Together, No Thanks UK, OK. They just keep changing the name and the paper headings. But what it is trying to drive up standards. And I had the great honour in 2000 in leading on setting the breast cancer standards for Scotland. We spent about a year and a half looking at all the key things that make a difference to outcome if you're unlucky enough to get breast cancer. And we set targets for them. And we pushed those targets up and up every few years. And if you looked at our data over the last 14 years, you would see those quality bars being met as the quality gets driven up. We meet every year. We put up a slideshow like this with all of our data, with our dirty washing, with our failures, with our successes, and we criticise each other. And we comment on each other, but we also share ideas and solutions. Because whatever problem a unit has at the moment, someone else in the room probably had that problem a couple of years ago. And that's because we are not rivals. We are not businesses competing with each other. We are a collaborative and cooperative NHS. Now, the funny thing is, when I point these things out up here, it's claimed I'm lying. And Scottish Labour particularly, obviously, have been attacking me for what I'm saying. And yet, south of the border, Labour are now jumping up and down, saying exactly the same. You can look up what Andy Burnham is saying. You can look up what Michael Meacher is saying south of the border. They say the NHS is on a knife edge. Charges are coming in. It will be gone in 5 years. But up here, exactly as was talked about by Isabel and Suzanne, we just get told, well, you know, you couldn't manage the NHS on your own. Well, actually, it's always been our NHS, right back since 1948. So what is the threat to us? Because when they get past that and they accept, right, OK, it is being privatised in England, we'll accept that. But it's devolved. Nothing can be done to it. It's absolutely safe. Don't you worry your pretty little head about it. It's devolved. But the money isn't devolved. They set our funding. So yes, our government, of whatever colour, can try and work out the best way to spend the money they get. But they don't control the money they get. And as was pointed out, we actually ship more money down the M1 than comes back up. If we were actually keeping that, we could protect our NHS much better. And you have to remember there'd be lots of things we wouldn't spend money on. We certainly wouldn't be building the sewers for London. I'm sure London can afford to build their own sewers. But we also would not waste over 100 billion on building a new Trident. Everyone talks about keeping Trident. Trident is finished in 2025. We have to build a replacement by 2025. And that will cost, in its lifetime, over £100 billion for something that cannot be used. I don't think we would have invaded Iraq I don't think we'd go around invading anybody else. So there's lots of things we would choose not to spend money on, and we would spend it on our citizens. Now, you will all have heard of the Barnett formula, which is the thing that's used to work out our block grant. And what it is that whatever England spends, whatever Westminster spends on public services in England, we get a proportion of that. Now, if people in England are paying for things, obviously the government isn't paying so much and we get less. We already have that with higher education, where children there are paying £9,000 a year to go to university. They pay prescription charges, so we don't get a little bit of that. If they start paying £25 to go to their GP or accident emergency, again, our budget will go down. Now, they keep saying, oh, but we've actually spent more. We've spent 500 million more, so why are you in a panic? I'm not talking about, this year or next year. The fact that they failed to save money, it can't really be made into a virtue. They didn't privatise the NHS so that it would deliberately cost more, other than that this is a stepwise move towards a more insurance-based system. That's what this little GP groups is about. And if you read the things online that are coming out of these think tanks, pensioners should start paying national insurance again. People with chronic illnesses should pay more. You're totally taking away the idea of we share and we look after each other. And that's the direction of travel. And so to me, the biggest threat isn't all of the formulas and what will happen to the budget this year or next year. It's the fact that if you picture 10 years from now, when their citizens have nothing, when it is an insurance-based, American-style, charge-based NHS, you really think they're going to send a generous pot of money up to us every year so that we can have free prescriptions, free dental checks, free eye checks, free personal care, and a free public NHS? That just is unrealistic. Now, the NHS is there to catch you when you fall. And there isn't an insurance policy in the world that would give you the kind of cover and protection you have from the NHS. Because insurance policies change from year to year. So whatever happened to you in 2014 will not be covered in 2015. So heaven help you if you get a chronic illness or an ongoing illness. But it doesn't give you health. Health comes from having a good start in life. We all know the impact of poverty and deprivation on health outcomes, short lives, unhealthy lives. We also know the impact on education. Teachers in primary schools say the gap is so big when a child hits primary 1, the school is really struggling to catch up. Now, what we hear from Westminster is, oh, these people are wasters, they're vandals, they're alcoholics, they're druggies, they're not working. We're just going to write them off. We don't actually have somewhere to exile them to, so they cost all of us money. They cost us money in benefits. They cost us money in police. They cost us money in prisons. They cost us money in addiction services. Why not take all the money we spend on failure and invest it in the child in the first place, at the start of their lives, and give them a decent chance? Because you don't know what talent is hidden among children in poor areas. You don't know who in among that is going to invent the next big thing or discover a cure for a cancer. So that's what we need to think about. What are our values? Are we happy to just let the big guys who went to Eton and are so smart and so posh, they'll make good decisions? We'll just stay attached to them. I'm sorry, that's like sitting on the Titanic and saying, I don't fancy the lifeboats. Water's awful cold. We need to get into the lifeboat. We need to launch the lifeboat. And we need to, as Suzanne was saying, show you can have a dynamic economy and then look after each other. Because the people in England are being relentlessly told there is no other option. You must pay. It must be a market. It must be privatised. If we show there's another way, then the progressive voices in England will start to wake up and say, we're not swallowing this anymore either. And that's how we can help them. We can't help them by staying on the Titanic. Now, I agree with David Cameron in only one thing. Well, it's two things, really. He said that two of the best things that Britain ever achieved were the welfare state and the NHS. And I would absolutely agree with him in those. Now, he put the BBC third. And I'm sorry, I wouldn't have put the BBC third. Not even anything to do with a referendum. I would never have put the BBC third. I would put free education third. I couldn't have studied medicine if we hadn't had free education, because I was on my own at that age. And I know the idea isn't that you pay then, but you pay at the end. But as a 19-year-old, I couldn't have signed up now for a long course like medicine to what would end up being £75,000 to £80,000 worth of debt. I simply would have gone and done something else. I've gained from that, and I hope my patients would feel that they've gained from that. And that's what we need to do. We need to invest in the talent of our people. Now, when you think about the welfare state and the NHS, it's not us that would be leaving those ideals if we become independent. We want to become independent so that we can keep those ideals. It's Westminster that is destroying the welfare state, taking away any sense of social security. They don't even use the term anymore. They're the ones who are breaking up and privatising the NHS, and their young people have already lost free education. So if these are things that we think we really value, that are really core to how we see ourselves as a society in Scotland, then we need to take control of them. Not sit here going, oh, I hope they don't damage it, I hope they don't cut it. We need to control them so that we make the decisions in the future. Not just for 1 or 2 years, not for 5 years. I want there to be an NHS for another 66 years. I don't want my son dragged into a war in 20 years. I want to know that I'll be okay when I'm an old biddy, because we believe in looking after each other, and not that it's sell everything to the highest bidder. So I hope we can be brave, as Isabel said, and go into that booth, never mind the stumpy pencil, take the pen and put your cross on yes, and be prepared to work, because the next 10 years is going to be busy, it's going to be hard work, it's going to be incredibly exciting. I'm amazed at the 98-year-old, but I don't want to be that age when we finally get independence. I want to be part of the team who actually get the chance to change Scotland, to build Scotland. And we all need to be part of that team. So once we vote yes, and in 2016 we get our independence, you need to be ready to get up off your backside, stop whinging, stop gurning. We'll have nobody to blame but ourselves. All the decisions will be ours. There will be challenges, but we will have the responsibility for where we go in the future. And we will be able to build a Scotland that we're proud to hand on to our children and their children. Thank you.